Now giving us his unique perspective on the local impact of healthcare reform, make welcome Montgomery County Commissioner Dan Foley.
Well, good evening. Thank you for having me tonight, Dr. Westbrook. Thanks for putting this together and for all the panelists. I'm going to speak for a couple minutes on the local impact of healthcare reform, and I think I'm going to start by this. I mentioned this to the gentleman on my side of the table here. I don't spend my days spending hours researching healthcare reform, so I have to tell you I'm not an expert. I'm not sure that I know experts. Probably many of the people here are, but I'm not. But I think it all comes down to this. If you're an elected official or you're a citizen of the community, the question is, do you believe people have a basic right to health care? And I personally believe that they do. And I personally believe that this dialogue that we're having as a country is one that's long overdue. I'm going to talk to you about two things that are happening in the county that I believe could be much better if we had a national health care program. I want to say that I ran across an article in my research that talked about, it was a guy, he's a professor, and I don't want to give, Dr. Reinhardt from Princeton. He gave these three broad principles, and I'm not going to bore you to death with them, but they seem to matter to me. One is that financial barriers should not stand between Americans and preventative or acute health care that they sincerely believe will address concerns over a troubling medical condition in a timely manner before that condition grows into a more serious problem. That makes sense to me. The second thing he said is, having received needed medical care, no American family should be so financially devastated by medical bills that that family can't meet their daily living expenses. I can't tell you the number of mortgage foreclosures in Montgomery County that are directly attributable to medical costs, but I used to be the clerk of courts in this county. We unfortunately have had a lot of them. And I always knew that a lot of those foreclosures were because people ran into situations with medical care that they couldn't pay their bills and the house of cards fell in. The third issue is that the future growth of national health spending should be constrained, or the third principle, should be constrained to fall significantly below currently projected spending growth, which has the U.S. devoting about 40% of its GDP to healthcare spending. So look, we do need to keep costs down. Not only, and that issue is starting to rise up, and it has been for a while. But we have to keep costs down for everybody. What's happening in Montgomery County? We have, according to 2004 statistics, we have 60,000 people in this county who don't have insurance. I talked to Dr. Mike Irvin, who led an initiative called the Montgomery County Healthcare Safety Task Force, Healthcare Safety Net Task Force, a couple days ago, and Dr. Irvin thinks that's up to 70,000. That's about, if you take the old numbers, it's about 12% of all adults in the county, about 52,000 adults, and almost 8,000 children. Given those numbers, we have a crisis, I believe. You know, that's too many people without insurance. There have been two specific efforts that have happened in the community, and there's some folks here who've been part of that. Dr. Gary Leroy is here from the East Dayton Medical Clinic. It's been to create a system. So the question is, how do we get to some of those folks who aren't insured? That's the question. And so this Healthcare Safety Net Task Force has set up a new system called the Federally Qualified Health, FQHC, Federally Qualified Health Systems, Health Centers, right? Health Centers. And that is where we're going to get all of the local healthcare centers like Dr. Leroy's to start working together, to start purchasing together. To start setting up quality metrics together, to start advertising if you have no insurance where you should go. That's one thing that's happened. The second thing that's happened, and let me say this about those clinics, they hope to implement the program to enroll people under 200% of poverty level in a program that provides them with a limited benefit of health care coverage up to $30,000 per year. So if you have a real bad, illness, that's not going to cover you. It's kind of like those Safe Auto commercials, I think. It's going to give you well checkups, routine medications, but it won't give you catastrophic care. And and I say this with all due respect to the folks who've been working on that project, because it's taken them a couple years, and it's really been, it's been hard because they're trying, there's not a lot of resources for this now. But even if that program hums on all cylinders, Dr. Irvin indicates that we're probably going to help 2,000 to 3,000 people in this county. So that still leaves 57,000 people in Montgomery County who are going to lack health care. So I just say to you that the problem is real in this county, and I don't have all the answers, and I can't begin to tell you what is in, if I took the, I can't begin to tell you the history of health care in this country, but I know we're at a point where I believe we can come out of this with something better than we currently have. And I want to end on one thing. That is that for people who maybe view this as just a moral issue, it's not just a moral issue. It's an economic issue, not just for families, but it's an economic issue for the companies where people work. If somebody can't get preventative care and their illness gets to the point where it means they're going to miss a bunch of days of work because they should have caught something earlier, then the companies that fuel our growth in America are going to continue to suffer. I read a message, I read the letter that the CEO of Walmart sent to the president in July advocating for robust national health care reform. And he said, and I'll end on this, he said, from a business perspective, health reform could not be more critical. A majority of Americans, 158 million, receive their coverage through their job or their spouse's job, according to the Kaiser Family Foundation. But few businesses will be able to keep up with the pace at which premiums are rising. Premiums are expected to rise by 20% in less than 4 years, costing 3.5 million workers their jobs and cutting insured workers' average annual incomes by $1,700. So for all these reasons, this matters. I thank you for being part of this, and I hope we get some good dialogue tonight. Thank you.
Thank you, Commissioner Foley.